Hi, everyone. Welcome back to Face It with Dr. G. I'm Dr. G, and I have the honor and pleasure of having Dr. Keith Marcus with me today, a dear friend and colleague who is a double board certified plastic surgeon, owner and founder of Marcus Medical with 2 locations around LA, and he is just spectacular. So, welcome. Can't wait to chat.
Thank you. Nice to see you. I feel like the only time we get FaceTime is now over a podcast.
Yeah,
So
and
we're gonna
very
we're,
rare
we're gonna change
conferences.
that.
We're going to change that. Absolutely. And Keith and I met at a conference
Barcelona.
overseas in Barcelona,
Barcelona.
Barcelona,
Yes.
at the MERS Summit. Yes.
Yeah.
And that was awesome. But that's one of the beauties, I guess, and distractors of what we do. And we can get into a little bit of that. But first, tell us a little bit about your background, where you came from, what you do.
Sure. So I grew up right here, about 5 minutes from where my office is in Los Angeles. I grew up in a place called Palos Verdes, and you know, education was somewhat circuitous to medicine. It wasn't a direct path. I went to undergrad at Berkeley, and I was actually a finance major.
Ooh.
So it wasn't until my the between my sophomore and junior year, I actually stayed and I worked with my dad for a summer. And I spent 3 months doing business valuation. I had an offer to leave Berkeley after 3 years and work in investment banking, and that was my plan. And after that damn summer, I'm like, I can't do this. I can't sit in front of a computer and be crunching numbers. And I'm like, oh my God, what do I do? And so, I was dating a gal, and her dad was a orthopedic surgeon, and I really I loved everything about it. And so I pivoted. So I actually ended up double majoring because I didn't take a single science class until my sophomore or my junior year at Berkeley.
Wow.
So, so yeah, it was a very different route, but as you probably know, there's some benefits to that if you go into private practice because understanding the business side can be critical if you're not outsourcing it. And so, it definitely played its part and helped out. And then from there, I stayed all 4 years, didn't go to New York to the investment banking job, and then I went to med school at SC, residency at University of Michigan, and then did a fellowship. And here I am, 18 years later in private practice.
Thriving in all the ways.
I mean, yeah, we're lucky. We're lucky. We are in a field that affords us to be a cash business, right? We're not handcuffed by insurance, by negotiating contracts and things like that. And that's the double-edged sword of what we do. That's why I think certain people get into it for the wrong reason because of that. And certain people do really well because they're focused on the patient and the money part comes later.
Right? And that's, I think, what it should be, right? You should never focus on the money. That's the wrong mindset. That's the wrong outlook. You'll have stress that's not necessary, and you just have to focus on
Yeah.
doing what you're doing well.
Yeah,
Um,
for sure.
yeah. So then, when you finished residency in Michigan, how was that, by the way, transitioning from California to Michigan?
It was fine for me. I didn't get seasonal affective disorder like a lot of people. It's gray. It's gray like 9 months. The cold doesn't bother me. It's just gray like 9 months out of the year. But I knew I was coming back to California. So I didn't have a problem with that because I knew that ultimately my goal was to go open a practice in Los Angeles. So with that, it's short term. It seems like 5 years is long, but it's really not. And so I mean,
You had a great
Ann
time.
Arbor, Ann Arbor, Michigan's a phenomenal place. Like, if you're going to be somewhere in Michigan, Ann Arbor's great. So, no regrets. I don't know. It was more about chasing the best education I could get than lifestyle at that point.
Hmm.
Now it's
So
totally
did
off.
you do, yeah, no, it's totally opposite. So did you do plastic surgery residency or did you do
No. So I
ENT?
did. So I did head and neck surgery, and then fellowship in facial plastic surgery. So, which is one of the things that I do. I love the face. I don't find a lot of the other surgeries in the body as interesting. But now, it does limit my practice. I have a partner that I brought on who's also a facial plastic, but ultimately my goal is to have a multidisciplinary practice. I want to have dermatology, I want to have general plastics. Eventually I want to have a functional aspect to it. But to be able to keep everything in-house when you have a good product and you create a brand, I think it's important. I mean, I am referring out so many like body procedures. It's incredible.
Yeah, and it just makes you think every time, if only we did it in-house.
Right,
Yeah.
right. And
Kind of a side note tangent. So you say you want to bring in general dermatology and
yeah.
these other things. We have functional medicine, and I've considered general dermatology. However, would you have that as a VIP cash only service, or would you do that as insurance based?
So, right, you would need both. If you bring in derm, in my opinion, if you're gonna for general, you need insurance base. It's crucial, but it also the things that happen in our economy are somewhat negated. It's like putting your practice on Prozac, right? You'll have fewer ups and downs when you've got a general and a cosmetic part to it. Um, but that does open the can of worms. Now I need a billing department. Now I need all these other things, which is painful. But my thoughts are I would probably merge practices before just bringing on someone new. And I actually, like about 3 or 4 years ago, I was in talks to merge my practice with another derm practice that was just the same size as mine. It was like the perfect marriage, 50-50 split. We did about 9 months of courtship, got into all the numbers, accountants, attorneys, yada, yada. And then it just like, there was something that just didn't feel right to me.
Mm.
Um, it was just, I think my practice was so much tighter and that practice wasn't, and that concerned me. But I think about it every day. I do. I'm like,
Yeah,
gosh,
but
was
you always have to go with your gut with those decisions. You never really need to know exactly why, but when you feel it's off, I think you act quickly and you did the right thing. You can always do it
yeah.
again.
It's hard. You know how it is. When you're bought into something, when you're so far down the road, it's that much harder to say, like, okay, well, let's not do it. I mean, we'd already spent tens of thousands of dollars, looking at each other's practice. And then you're like, oh my gosh, this could be so great. And then to break it off is tough.
Hmm. Yeah, but
But
you have to stay alert and ask questions and um, you know, you can always hear things about people's practices or whatever, and you obviously did a deep dive into it, but you
yeah,
have to do your own research and you have to figure it out on your own. They can tell you certain things, but you have to do your own research. And I'm sure you probably uncovered things that you were just like, this isn't what we were told, or whatever it is.
totally.
Um, that's actually in that book I told you that I'm
Oh, it
making.
is?
How
Okay,
leaders
I'll
learn.
start doing my own research.
Yeah.
Heck, I'm in. Is
Yeah.
this
I mean,
the
I told you.
how leaders learn?
Yes, the one that I
Okay.
told you before we started. How leaders
Yeah.
learn, because you're thrown a ton of opinions. There's a bunch of different personality types out there, obviously, and people that listen. Listening is number one, the biggest thing you need to do. But how you learn, and you learn by listening, but you also learn by asking questions. And I've never been someone to adopt any fact, quote unquote, that I'm told, or any opinion. And opinion generators and sharers also aren't my favorite types of people to interact with because they're
Yeah.
not listening. But you have to ask the questions and you have to do your own research, period.
I mean, I think this is what we're seeing a lot in medicine right now, right? You've got a
Yes.
rep that comes in your office and they're like, hey, you can do this, you're going to use it in this way. And it may just be their opinion or their small N of like 5 offices they have. And now all of a sudden, people are adopting. They're like, oh, rep came in, said I can do this. And I think there's a lot of discussion now around, well, we should be doing more research into these things. We should look at safety, efficacy, data. Is there research on it? All those kinds of things. But most don't, to be honest, most don't.
Well, people have blind trust, especially when you're early on in a business. You look for support and you trust
Yeah,
people too easily. The other thing you'll learn is everyone's in it for themselves. No matter how much you think they love you, they're in it to grow themselves in their business and hit that goal at the end of the year so that they can go on the trip. And I'm
that's
like,
right.
okay, well, maybe it's about time I start to think about my business. And yeah,
Yeah,
you can live on two different planets, but at some point you'll come together and you'll say, no, this works for me. Will this work for you? it never hurts to ask. Um, and so you just have to think, not selfishly, but you're doing this for you and you want to
Yeah.
work with people. So,
See, it's, that's plagued me over time because I order from every company. So I don't have any really high status with any company because I order every product out there, literally every product,
neither do I.
minus Bellafill. So, but I look at it in the end and I'm like, this is what's best for my patients, right? I want to be able to grab a certain filler for a certain rheologic property on a certain skin type. And if I don't have it, I don't want to just make do. But I look and I could probably cut my cogs down 15% if I change that, possibly even 20, which is huge. And I think about that all the time and I revisit it and I always end up with I want to do what's best for my patients. And if I'm making less money, that's fine. That's for now, but hopefully those results will grow my practice over time. It's hard to know.
Yeah, it's hard to know. And obviously, the patient, well, in my opinion, the patient doesn't come first when you're a business owner. The team comes first, the patient comes second, because that really means the patient's first. If you don't have a good team, they can't take care of your patient the best way possible.
Yeah.
Um, but this question I have for you, and I don't have an answer, I mean, I
Yeah.
have my opinion. Do you really think that all the fillers are that different, the HAs?
I
Do
do.
you really think so?
I do. There's certain fillers that I can't, like, there's only that one filler that does this. Like, for instance, if you're doing an etched line, like RHA Redensi, I don't use their other products. There's nothing like it. You can blanch it in the true dermis. It doesn't show. It'll erase an etched line, a smile line, a perioral line. Listen, wrestle and refine for the corner, turning this up. Nothing works like so. I do. I
Yeah.
think there's things like that. Velux is worlds apart from any other HA we have. Unless you're gonna mix Kaha and something, it's completely different. So I do. I believe that. Now, I think that took me well over a decade to understand those nuances. So I don't expect um, people that aren't very well advanced in their craft to know that or to make a difference. But I do feel like for me it does. That said, I could make do with one portfolio of fillers for sure.
I think two. I think two, because I think having a blend of them, what I'm finding, and I completely agree with you. What I find though is that the newer fillers that we're seeing that are a little bit more universal, maybe a little bit of the softer lower G prime
Yeah,
products, can tend to be a little bit more similar in the way they
yeah,
behave. But what I will say is another reason why I love ultrasound is because you kind of see, you're able to see how those products look over time in the tissues. Yeah, their placement and all that, but how are they really looking over time? I know you don't like ultrasound, but
no, I
you're
let
gonna
you
come to
said
face it.
another reason and you hadn't said your first reason why you liked it.
Oh, oh, the first reason, another reason why I like ultrasound. Well, I like ultrasound just for day-to-day practice, just for injecting and
Wait, now I'm learning from you. What ultrasound? Because I've been looking into it recently and I will tell you why.
oh, well, then we have to talk about that. So I have Clarius and Mindray.
Okay. Which
They
do you like?
offer different, they're different technologies. We prefer the Mindray.
Okay,
It is
that's what
the
I'm looking
best
at.
technology. Yeah,
Yeah,
I need to
good.
connect you
You
with
love to spend money.
my person, Joel. What?
You love to spend money.
I don't
The
love to
mind ray's
spend
more
money.
expensive by a long shot.
It's actually not that much more expensive, but the imaging you get, the technology that you get, and the time you save, in my
Yeah.
opinion, is worth all the money in the world. And we should talk about where you're getting it from,
Yeah.
because we have really good connections. I have really good connections, and
Oh,
they take care
yeah.
of you.
Send me that,
Yeah.
please. Um,
Joel Srirachi, I will actually just give him a shout out from um, Regent's TX Medical, I think is what it's called, REGENTX. I'll connect you guys. They are
okay.
just phenomenal.
Okay,
And
great.
then you have to
Thanks.
come to Face It Live so you know how to use it. That's in
I
October.
will. I will.
You're
Oh,
gonna
I
come
saw that.
this October. Yeah,
Wow, wow.
yeah.
Yeah, I'll be there.
Oh, you'll be there. In what world?
So
Uh,
I'll tell you a story.
okay.
Um, th- Listen, the best way of learning is through your own mistakes. It's not the desirable way, but it's what sticks with us the most. And because it's a hit to your ego. When you have a complication, it hurts your ego, and you remember those things much longer than you will ever remember your successes. And you're going to research, how do I avoid it? What could I do differently? All those things. So when you have a complication, you really learn from it. So I had a patient. So we do a lot of clinical research, right? We've done, the FDA was in my office all last week, two agents, 8 hours a day, like going over one single study. And it's a lot, it's stressful, etc. So we do a lot of clinical trials. We've done about 25. I had a clinical trial patient, and I'm injecting along the jawline, and I have my technique where I put my finger and I compress the antigonial notch, and I don't get there. I finish the injection, last one here, and it just starts blowing up like a hematoma. I'm like, what's going on? And I'm looking, I stop, I'm like, okay, we're done. And something's off, but there's zero skin change. So I have the patient go with my clinical research coordinator. She lets her go, and my coordinator says on the way out, she's like, it looked like it was a little bigger when she left. I'm like, okay, call her, get her back now. She's like, calls. Patient's like, I just want to go home and go to sleep. Mind you, it's like 10 a.m. Another probably red flag. Why do you want to go to sleep? Like, that's weird. Anyways, at about 7 p.m., I get a picture, and it's just the faintest. Most people would never pick up, but you see there's just the faintest thing. Main stem, facial artery. I'm like, you need to come into the office now. And what did I do? Well, we started with local Hylenex, about 8 vials, no joke, and it cleared up a good majority, but it wouldn't clear up two spots. And like there was one here, one here.
What did the spots look like? Were they pale or were they red?
No, they were pale. They started to be a little dark. But I could show you a whole. I have pictures for days. Anyways, I ended up I cannulated the facial artery without ultrasound, and it took me a lot longer than I thought. It took probably like at least 5 minutes for me to get that artery, and that
How did you
that
do
was.
that without an ultrasound?
I mean, you know where the antigonial notch is,
Yeah.
and you just go down to bone with. I just used a butterfly. I had my MA with me who had a 10 cc syringe with Hylenex in it, and then once you finally get that bright red blood, you press. Now, I haven't done that before, so one thing that the minute you did it, because there's temperature difference with the blood, she jumped because she felt it flow, and I'm like, oh no, but it
Wow.
it cleared it all up, and there's zero tissue damage. She does have post-inflammatory hyperpigmentation because she was a Fitz 5, but there's no like none of the tissue died. We sent her to hyperbaric for like 5 days, but after that I'm like, you know what? It's only the second occlusion I've had in 18 years, and I think it's worth it. Like had she most of that would have been dead, and for most people that might have been the result. And so I think it's worth having.
Yeah. But that's an even better example of how we're truly believing now that skin changes don't happen at all sometimes and definitely don't happen immediately because it's the perforators that are the when those are occluded or compressed or there's a spasm, the perforators that reach the skin are the ones that cause the skin changes.
Yeah.
So when you get the deeper vessels, you get different symptoms. And I'll tell you, swelling is one of those. When I've had two occlusions in the lip. One of them I'm not sure was an actual occlusion, but lips in my mind are easy to resolve pretty quickly just
Yeah.
because they're such a small area. But it's swelling. It's not painful. No
Yep.
skin changes. Can be a little purple, I guess, but it's swelling. And I don't think people really know that.
The lip always swells. I mean, we see a lot because a lot of them get referred over, but the lip does almost always swell. It's hard to see it sometimes in the face. The other one I had was forehead. I was injecting forehead,
Oh,
and it was this pattern here, right? Like this. And I couldn't tell there was any swelling. It was just pigment change at that
yeah,
point.
yeah.
Um,
But wouldn't you want, just being devil's advocate, or maybe not really, wouldn't you want to go to an injector that has dealt with these complications that are sent to them by other providers, but also dealt with their own complications. I personally think that's admirable.
I think I mean, absolutely, you want that, but most people don't want to make a practice of it. The benevolence of medicine, it's not as strong as we think. Like,
Mhm.
so many people will not see other folks' complications. And at some point, right, you do what feels right in your heart. So if someone sends me an occlusion, I know I might be named in a lawsuit, right?
Mhm.
I'm helping to resolve a complication, but I'm also very well aware of the medical legal perspective. I do a ton of expert witness. And so I know that I'll be named in a suit if this goes to court, and that's okay because I think that what I'm doing is in their best interest. So,
Yeah. No, I agree. And I think with ultrasound, obviously, the majority of people bring an ultrasound into their practice for quote unquote safety. I don't like using the word that makes me a safer or better injector. It's a tool to enhance the outcomes and create a more well rounded experiments to deal with anything that's thrown at you, right? But if people bring it in just for complication management and it sits in the corner for 10 months out of the
right.
year, or even more, it's not worth it. So encouraging people to use it every single day. I have learned so much from my ultrasound. I love using it. It's fascinating. I love growing my providers in that way and seeing
Yeah.
them have all these light bulbs go off with, understanding anatomy. And the 3D nature of it is interesting. It makes people think a certain way, and looking at the differences in qualities and characteristics of the product, specifically between
Yeah.
Radiesse, calcium hydroxyapatite,
Yeah.
and HAs, how they look, how they behave. I don't know. It's really fascinating to me. I think
No,
it's
that that actually that's what stuck with me with when you said that to see how these things are behaving over time. It's exactly right. Do they integrate in the muscle or if we're doing hyperdilute kaha in the neck, like is any of that getting the SMAS and right? I don't know.
yeah.
Because I don't look at it.
Hmm. Yeah, well, it
Um,
definitely is in the SMAS, and if it's not initially in the SMAS, it can get into the SMAS, and that's when the
yeah.
patient's faces move differently, they animate differently, their eyes are smaller, and so many faces I've changed that come in and the first thing they say is my smile's different or my eyes look smaller. Why do I look so wide? And it's playing catch up between the upper face, lower face, and widening them so much. And then when you see them and they say I want to look back to normal,
Yeah.
instead of being overwhelmed with I have to dissolve their entire face, let's focus on what's actually being affected and what's affecting their movement, which is the SMAS,
Yeah.
mostly mid face.
Yeah.
And ultrasound can really speaking about cogs, you're decreasing your overhead, you're not using as much Hylenex, but also more importantly, you're not flooding the tissues with a liquid. It doesn't come without risk.
Yeah.
So
That's true.
I'm excited for you.
I know. I'm excited.
So
Um,
I'll come visit. I can help teach you all the things.
okay.
Learn.
Yeah. I'm gonna bring you on. Honestly, that'll
Yeah.
be. Wait, when is Face It Live? Is it October what?
Face It is 24th through the 26th.
Okay, I'm
You'll
gonna
have
look
to
at
look at
it.
your calendar. I know you're not going to come, but I
Halloween's
still
our
would
big
come.
my the Halloween's my big holiday. I throw a big Halloween party. Most normal people celebrate Hanukkah, Christmas, Thanksgiving. I'm like Halloween.
It's before Halloween. You'll have
I know.
almost the
Thank
entire
you.
next
The
week.
26th is before the 31st still?
Yeah, we do know some things.
Um, quick question on ultrasound. Do you actually map patients or no? Like, do you do vascular mapping before treatment? You
Yeah,
do?
so always with certain treatments and sometimes with others. So
Wow.
I always vascular map with the temples,
Hmm.
uh, and typically, and always with the piriform. So those, because the angular artery can be variable among sides, there can be 1 to 5 branches, and if it's within a certain distance from the bone in the piriform, I won't inject. Um, I won't inject deep. Temples, mostly for placement, determining if I want to
Yeah.
go subcutaneous, layer 2 for bone. Layer 4, interfascial plane can be tricky, it's time consuming, but it's really good to understand the differences. And the interfascial plane is shown to be the most significant for affecting the lower face as well when you inject there. But I'll typically go in, inject some saline, open the space up, and then
Yeah.
inject the HA. Uh, the other areas of the face, typically it's not routine, but we can if it's requested or whatnot.
Yeah. And you don't charge for that.
I do.
You do.
So I do. If it's if it's a treatment like the temple or the piriform that the ultrasound is a requirement on our end, it doesn't. There's no charge. So I guess the
Got
answer
it.
is no to your question. But we do charge for just ultrasound examinations if patients just want
Yeah.
to see what's in their face. We charge for ultrasound guided dissolving. Um, yeah,
That makes sense.
yeah. Sorry. So
Yeah.
yeah, I guess it was no.
I mean, I think it's again great food for discussion because I think there's no exception of no one has said it's better to do ultrasound or it's not better. Like there's two sides that are talking and communicating. And some people have strong opinions. It's
Yeah.
just always hard without having like, well, I did 100 with ultrasound and 100 without, and what was the difference in complication rate? Because fortunately, the complication rate is low enough that that study would go on for ages to get any sort of number which showed a difference. So,
Yeah.
but I think there is true value in it.
There is, and we see it every single day. We get patients that have tried to be dissolved. They have a complication, a current complication, try to be dissolved, and are flooded with 8 vials of Hylenex, and they come to us and we dissolve it within seconds.
Yeah.
And some of that is the education where you dissolve in a different manner perpendicular to the skin when it's a a perforator, a feeder vessel going to the skin. Um, it's putting all of the pieces together and just utilizing it the best we can. And we're still learning. I mean,
Yeah.
it's very new in the space. And there's an ultrasound that it's called Cybus. I don't know if you've heard of it.
Haven't.
It was launched in Europe. I don't even know if it's widely available yet, but I was part of the advisory board during IMCAS this past year. And it's on the finger. So it's a probe that's literally on your finger. So the whole purpose of it is that it's easy to use your hands when you have it. It's not so chunky.
Right.
Your dexterity is maintained, but there's problems because the smaller the foot plate, the less resolution and the less the quality of the image that
Yeah.
you're seeing. Um, so working through all of those kinks, but it's
Yeah.
expanding rapidly, and so we'll have that technology at Face It as well.
Oh,
So
nice.
Cybus, Mindray, and Clarius, yeah.
Well, I commend you for doing it because there's not a lot of amazing courses with ultrasound. I mean, I can think of 5 people around the nation that are very dialed into it, but I mean, that doesn't make it readily accessible when you've got thousands of practices that could be learning it.
Right. And time is money. Money is time. People don't want to spend the time learning something that doesn't directly benefit them, usually
Yeah.
from a financial standpoint. And
Right.
that is closed-minded thinking, in my opinion, for many reasons.
Yeah.
I was going to say something else to you. Oh, yeah, and I think there are a bunch of ultrasound courses that have incorporated anatomy. Face It was the first one. We kind of started the concept several years ago. But my goal for people that come to this conference is number one, it is full on education the entire time. There's no partying, there's none of this. It's literally education the entire time. And you leave not only knowing the business of ultrasound, we have complication management panels, safety panels, we have case discussions. It's hands-on with different technology. There's a cadaver lab that's 3D cadaver. And the first time we did it, we had multiple cadaver heads, but we
Yeah.
realized the focus is ultrasound, cadavers additional to the learning experience. And we have these 3D huge screens all over the room that are split with the cadaver that's actively being
And the
dissected
ultrasound.
and ultrasound.
That's
So
cool.
how can we just really reinforce it and you leave and you're like, okay,
Yeah,
I
that's
need,
amazing.
yeah.
Yeah.
So
Nice.
anyway,
Yeah.
okay. So talk to us about so you got into, you got back from LA after your residency. Did you start your own practice right away? And tell me how you got into truly doing non-surgical injectables, not just
Yeah.
surgery.
Okay, so yes, so I just hung a shingle, and this is in 2008. So the nadir of the recession, right? So you couldn't open at a worse time. And I opened this, 2,500 square foot office. I had a full-time employee who was my office manager, receptionist, yada yada, like everything, and then a part-time esthetician. I kid you not. It was like 2.5 people, big office with, I don't know, like 6 treatment rooms and I figured, hey, I grew up 5 minutes from here. I'm gonna hang a shingle and people are gonna start knocking the door down. was not that way. I remember I'd hear like, you know the alarms you have on your, and if a door opens, it'll go off. Well, I'd hear it and I'd run up front and I'm so excited. I'm like, my patient, I'm like,
The
oh shit,
mail.
the
Gotta pay
mailman
my
again.
bills.
Yeah, yeah. And it was like, oh my God. So I was working 7 days a week for probably a year and a half. And then I went down to like 6 days. But for the first 5 years of my career, I was working 6 to 7 days a week because I didn't have cash flow to pay more employees, etc. But I think what happened was the time I had with the patients I did see was so, like, I put so much into him. I called every patient after procedures. Like I did everything I could because when you open your own business, it's about critical mass, right? You eventually hit this point where it climbs, 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 and then the referrals from all them make it so you can have a successful self-propagating business. But you need hundreds of happy customers first. So it took a while to build. Everyone says, listen, some people do it. Some people open and they're so busy right away. I mean, it was 5 years for me to feel really comfortable that I wasn't going to be like, oh crap, I need to shut my doors, right? And so then, over time, you just do good work and you find good people. Your team is everything. I mean, it's all about finding people that align with your same core values, right? Because the the company culture, I think, means as much to you as your employees as your patients because they choose us and we choose them. Like if there's a red flag, you're sending them out or referring them, but they choose you based on your personality, what they think your experience is, how they like their treatment and experience at the office. I tell everyone, I'm like, someone can come in my office and have a mediocre treatment and a fantastic experience, and I promise you we'll see them again. But if they have an amazing treatment and a mediocre experience, they're not coming back.
100%.
And so much is based not on our skills and what we do as much as on everybody as a whole. And so, thank God it worked out and, we took over more space in the building. We opened a second side. So in our main building, we took over the second side and then the building wouldn't let us take any more because I guess they can't get insurance coverage if one tenant occupies too much. So so that's when I decided to go to Manhattan Beach and open the second office. And I feel lucky, but it's a grind for people that think it's just they're gonna open their doors and just slay. It's not always that way.
Mm-mm. And even more so now when you look at the saturation of the industry, and I do think smaller practices that injectors will branch off and open their own. I think that's
Yeah,
becoming less and less. I think now it's private equity that's kind of causing issues, but people want to be part of a community. They want to learn together. They want to be together. I show up every day because of my team. I wouldn't do this if it weren't for them,
yeah.
and they are my purpose. Um, but I was going to ask you something and I totally forgot.
Oh no, it was probably good then.
Oh, why do why do your patients keep coming back? And I loved what you said, but I also think it's honesty and authenticity. So, and transparency, because I have patients that will come here and they'll do an initial consult, which we charge a fee for that even, and they do or they don't get a treatment. They leave, they go get other opinions. They come back because they know I will be honest and transparent, and I will tell them no. I will say, well, I'm not doing that. I understand XYZ. I understand this is what you think. I understand you want all of the filler gone in your face. Number one, I can't do that. Number two, I can't do that. Number three, I won't do it.
Yeah,
And then they're just like, okay. And I'll say, this is what we will do. And something about medical aesthetics, patients feel that they are educated, which they are very educated actually, but that they can dictate what we do.
yeah,
And we don't do that here. That doesn't mean I don't listen. I listen to their entire story. I hear them and I acknowledge that I hear them. I meet them and I say, I can or can't do this. And I think that totally shifts the confidence in you as a provider, the trust, and the willingness to return.
Yeah, well, I think it's absolutely true. The problem is the ones you say no to, they want you even more. It's the
Yep.
hardest thing because when you tell someone they're either not a good fit or I mean, you don't say it like that, but then they're like knocking on your door. I need
Well, they're
you.
like, wait, she won't treat me. I feel
Right.
rejected.
Right. And so that's a hard thing. But I do think, yeah, honesty, like we put so much of our own kind of values on whether it's worth the spend or is this expensive for them without knowing the patient. And like you said, all you can do is communicate. I learned this great lesson from one of my best friends who's a plastic surgeon when I was early in my career. I did a rhinoplasty on a patient. He was in my office and I'm like, hey, come in for the post op, right? We take the cast off and she's happy as could be, right? And she's just like over the moon. And I see something, I'm like, I'm not sure. I'm not sure I love right here. I'm just like, and we leave the room. Her affect just drops, becomes flat, right? And we leave the room. And my friend, who's, been out probably 5 more years than me at this point, he's like, what are you doing? I'm like, what do you mean? He's like, you had a perfectly happy patient, and you decided to put your values and what you thought was good onto that patient, and now she's unhappy. And I'm like, huh. And
But
it
did
made
you ask her, did you say, what do you think of this spot? Or did
no,
you project
no.
your opinion?
I
Interesting.
projected my opinion.
Interesting.
And then it made me realize that so much of what we do is about, like you said, with listening, it's about understanding what they really are looking for. Because there's times where I see a patient back and I'm like, oh man, that's like a single or a double. And they're as happy as could be. And I have to be okay with realizing that's all that matters. Like, I feel like I could have done a better job and I still can, but if they're happy, I'm not going to start trying to convince them to do more. I can make it look better because now I seem like a pushy salesperson. So I think really knowing what they are complacent with, pleased with, and over the moon with has to do with the conversation prior to treatment.
100%. I think
So,
that's golden. Everybody needs to listen to that. And, uh, the flip side is you have patients that will never be happy.
yeah,
And especially with rhinoplasties. And I used to do the non-surgical nose jobs, and I don't do them anymore for many reasons, including lack of transparency around previous rhinoplasties, et cetera, and the safety of it,
yeah.
high risk area. But how do you deal with those patients that are never happy, and how many revisions can you do? And
So, I mean, listen, there's the perfectionist, right?
mhm.
Who is no matter what, they'll be happy for 2 weeks and then they're going to find something they're not happy with. The one that has seen like seven cosmetic people before you, these are all red flags to me. The perfectionist, I will deal with and take them through it and just go like, listen, here's what you can expect. It's never going to be perfect. Like you can tell these people. And so if I don't think it's a fit, those are the people I keep out. I'm not going to treat. And you just say, I don't think I can achieve what you're looking for. And yeah, they get a little upset, but you're going to have an unhappy customer if you do treat them. It's a hard thing. That takes time to get to know that type and that category of person. Fortunately, it's not a huge percent. Those people are probably less than 5% of who walk in the door. But if you treat them, they're going to be unhappy. You're going to eventually just be giving a refund, spending your time, and it's not worth it.
No, absolutely not. So, how is your time broken up during the week or even during the day between non-surgical and surgical?
Okay, so in the beginning
Get out the calendar.
it was much more surgical. Now it's much more non. So um, I'd say so. I'm not working Fridays. My
Love
wife
that for you.
my
More of
wife.
a reason why you come
By the
in
way,
not to
and
work.
I kind of don't work Tuesday and Thursday afternoons. I need to get. My wife's like, you need to get back in the office. I'm like, I love my life.
It's because she's running the show now. I see it.
No, no, she's not. She's
She's running the
working though.
show.
Um, so Couple days, so I'm in my Redondo office Monday, Wednesday. So we do a lot of clinical research those days, and then I'll do uh, non-invasive stuff, so injectables and lasers and things like that. Then Tuesday, Thursday, I'm in Manhattan office doing a lot of post-op things. Um, Thursday, Thursdays sometimes Thursday, Friday will be an operating day. So if I'm off Friday, I can operate Friday. But those days will be consultations, post ops, pre ops. And so it's basically 1 day a week in the OR now, which is, for me, I like doing less and less in the OR. The OR is much more lucrative, but I don't sleep the same the night before, the night of. I'm always concerned, is there going to be a hematoma? Is there going to be something I'm going to need to deal with? And I also am somewhat of a perfectionist. I'm not happy with any case I ever do. And so it's just a little bit of a hard thing as a surgeon. So many of my colleagues are just like, "Hey, I did a good job. It's good enough." And I envy that. I wish I could be like that. But because of that, I enjoy, like, I get just as much of a change in someone's confidence doing non-invasive things as I do oftentimes doing surgical things. And for me, that's why I brought on a partner. I've shifted. I don't even do rhinoplasty. I shifted all of that to him. And then because my prices are so much higher, it's an easy transition when someone sees a price and I'm like, listen, my junior partner's amazing. If finances are at all a thing, like, let's meet him and you can get both our. And so I'm just trying to put more of that over because ultimately my goal is that when I'm not in the office, that it can be self-sustaining, right? That I don't need to be the one doing a majority or bringing in the revenue. And that's why, I've built something where, the other 20 people that I work with really contribute significantly to the business as well.
Yeah, which is amazing. And it's all about quality of life for you. What makes you tick may not make the other person tick.
Yeah,
Um, and I know you speak so beautifully on stage, and you speak a lot about global rejuvenation and full face, and your results are just so awesome. Um, but what's your favorite thing to talk about? Is it truly global rejuvenation? Is that what you like to do the
hundred,
most?
100%. Like,
Yeah.
so every consult I do, so every new patient, and it takes me maybe 90 seconds, but I do the full facial shape, split them in two, do vertical thirds, vertical fifths, horizontal thirds, but then just take them top down and just tell them what I see without saying what we can do. And everything that you say is educational. It's not, at that point, there's no sales, you're educating. And you'd be shocked how many times people are like, I never realized that with my temples. Oh my gosh, can we do that today? Right? But I think that facial shaping is by far the most impactful thing. I think that's when people look much younger. We're talking where you can look 10 years younger or so much less tired, whatever it is. The problem is that it's done by a lot of people with too much product. And then you get the opposite, right? You get people that they look bigger. Like if you look at any people that have had 8 to 10 syringes, oftentimes they widen,
Yeah.
right?
It gets
And
worse over time because of the absorption of water.
totally.
And so
The
they
the
can look great
breakdown
right
products,
away,
yeah.
but yeah.
Yeah, and so I think we need more focus on it because there should be algorithms about where you treat first and why. And there's not, like, I know there's MD codes and things like that,
Yeah.
but in general, I think it's dependent upon that individual's face. And like if you have an over exercising Caucasian female, like I'm gonna do preerect and temple before I do cheeks, before I do lips, before I do piriform, before I do jawline, because I need to set that framework so they look back to that oval shape they had and not this scream shape, right? So it's my favorite thing. Yeah, yeah, in other words, you don't need to. But anyways, like, yes, I have a passion for that. I love doing full facial rejuvenation, and those people are pretty much always happy.
I agree. And then tacking on, do you do those biostimulators and then have radio frequency microneedling afterwards and really enhancing the skin health and watching over time how their muscles change. The modulation is beautiful, and when you do things together, it's transformative.
Yeah.
So,
Yeah, I mean, skin is part of the console. I mean, I talk about volume, sag, and skin basically. And so we do touch on that. I do the CO2 laser, tons of CO2s, but all the others, the halos, the moxies, the BBLs, all that kind of stuff, I pass off to my nurses. But yeah, I think it's a critical thing. Like we've got a couple full-time estheticians so we do a lot of skincare as well. And so I think again, it's more keeping that everything in house and keeping everything a little bit. Uh, I don't know. I mean, I would
just a
say it's
well-rounded plan. Like they're being taken. It's multidisciplinary. They're being taken care of by multiple
yeah,
providers, and
yeah,
yeah, I
which
think
only helps. And listen, I hear people all the time. They're like, "Well, I'm offended. My nurse took this patient." I'm like, "What?" I'm like, "That's what you want." Like when people are like, "Oh my God, your nurse is so much more gentle than you." I'm like, I
go
know."
to her or
See
him.
her.
Yeah,
And
way
it's
better.
true. And
And
they're
I
right.
tell them, I'm like, yeah, they're right. And, they all inject my face. Why wouldn't you trust them? I've trained
Right.
them, all of that. So, well,
Yeah.
this has been awesome. I know you have a patient, so I've been
Yep.
like kind of aware of the time, but
I
we could
miss
go
you.
on and on. I know,
I
I
can't,
miss you
I
too.
can't wait
Well,
to hang, and I will look at those dates. Maybe
okay.
Chrissy can
I
come
mean,
out.
it's last minute, but I actually will be out in California in December, so I'll
Oh,
text you about it.
yes. Awesome.
Yeah.
Well, thanks for having me, Gretchen.
You're welcome. Thanks for
It's
being
nice.
on here.
Yeah, it's nice to see you, and I'm so happy for all your
Thank you.
success.
Thank you. I feel the same. And for all of those listening or watching, can you tell them how to get in touch with you, either social media or?
Yeah, social probably the easiest. It's just Dr. Keith Marcus, Dr. Keith Marcus at Instagram. I don't know. I suck. The truth is, I'm the worst. Like the best way to get a hold of me is write me a letter.
Yes, in the mail, because
That's
he
right.
will get the mail. Um, However, no, thank you so much. This was awesome. I can't wait to see you soon. Tell Kristen I said hello. I miss her.
I will. I will.
And
Bye.
thank you all for watching, listening, like, subscribe, share, and we'll see you next time.
Bye, guys.